Hello everyone, this is Aditi, and first of all I want to thank you all that we are a community of 500 plus subscribers now. As you all know, I am Aditi who has done masters in yogic sciences. Along with that, I have done a lot of courses in physical therapy. So I have been someone who have dealt with knee pain in the past, and then we started a researched backed program which we call as the leg strengthening program. So I want to start an educational series in which I will tell you about some exercises. I'll tell you about what arthritis is, what knee pain is, where the knee pain is and what it means, and we'll use some things like resistance band, foam roller, yoga block, dumbbells in our exercises. But as of now, for today's topic, what we are doing is we are gonna know about bone on bone. So basically, most of the people come to me and say that arthritis is bone on bone, and my doctor has said that these bones are like crossing over and they are very much closer and all those things. So what it actually is, we are gonna talk about that. Along with that, I'll be giving some examples from few case studies that have come with me, and what is important and what actually is true, and is arthritis actually a bone on bone thing or not. So I've made few notes. I'm gonna open them by my side and I'll explain those things to you. Okay, so if you have any doubts, you can put in the comments section below, and for sure I will either try to make a video on that or I will try to respond in the comment section itself. So first of all, I would explain what all things people say to me after they come back from the doctor, after they come back from a physiotherapist, when they show their X-ray or MRI to a physio, what all they get in their mind. So there are few things that I hear a lot, that people say to me that my knee is essentially ruined, and pain always meant to them that they are wearing and tearing the knee more and more. And then last but most important, to understand why doctors say this point and why this is a wrong point, but doctors are saying it in a different direction. Okay, so you need to understand that way. So the last point is that I should avoid certain activities to preserve what is left. So people say that doctor have told me that my grease has reduced, or my synovial fluid that is in between the knees have reduced. So now I need to avoid sitting on the ground, avoid hiking, avoid trekking, avoid stairs and all these things to prevent or to preserve the 10% or 20% synovial fluid that is left. And this is a very wrong thing to put in your mind, especially at the initial grades of your osteoarthritis. So here I am to keep out with all the things. Honestly, if I tell you about myself, I had an accident few years back, and it was an accidental injury because of which I started having a lot of pain here, and then I developed some nerve compression in my lower back as well. That 1 year of rehabilitation, then coming back to my normal routine, took a lot of patience and a lot of exercises which you might not be aware about, and which your doctor might also not be aware about. So it is very important to learn from someone who have gone through the same thing. And then there were different pains that were developing in my knee, and for 1 year I was feeling that I'm not gaining strength, maybe I'm reducing the strength, but that was not the fact. Eventually I gained that strength that I required, and I have helped over 1,000 women to overcome their knee pain through my leg strengthening program in the past 2 to 3 years. So in today's video, finally we are starting it over. In today's video, what we know about arthritis pain and bone on bone thing. Now I'll tell you few points, like I've noted down 1, 2, 3, 4. Okay, 4 main points I'm gonna discuss in this video regarding the bone on bone thing. Okay, so the first point is that your X-ray don't predict the pain. So I have seen a lot of people who come to me with an X-ray, and suppose the initial gap was this much and now their gap is almost this much, as if their knees are colliding. I mean, the gap is almost close to zero, but they have 0% pain. Even I will put a picture here and you will be able to notice that this is a research in which it is shown that people, even with in the cases of meniscus tear or some ligament injuries, there are around 7 to 13%, 20% people who are having zero pain. Okay, and me myself, I haven't undergone any X-ray, any MRI for my knee. I have for my back, I haven't for my knee, and in the past 5 years I have done only one MRI. But people put so much pressure for MRI, which I think is not that much valuable until unless you have a lot of pain and your pain is not getting better with exercises. So first is exercise, and then you may go for an MRI, which will eventually tell the physio that okay, this is the thing. Now there might be some avoidances that they will include in your exercises, right? So that's the thing. And large researches and studies show that the amount of arthritis seen on an X-ray often does not match how much the pain a person is having or is facing. Many people I have seen in my cases also, and I've seen a lot of people with severe arthritis on imaging, but little or no pain. Okay, that's not because of maybe the exercises they are doing, but the routine and the lifestyle that they have in their everyday life. Then there are a lot of people with a lot of pain. Like few days back only, I had a person coming over to me and saying that my X-ray says osteoarthritis grade 1, and I have so much pain, and the pain that the person was described was almost of a person if the person have a grade 4 osteoarthritis. And I was not shocked, because I have seen a lot of cases like that. But it is also a mind thing, that osteoarthritis is not just a physical body thing, it is also a mind connection, how much your mind is connected to the knee, how much circulation is going there, how much blood is going there. So that is a very different thing. So you are not your MRI or your X-ray. So even if your pain is more and MRI says less, that's I believe a good thing, because then your mind will think, okay, it's just grade 1, it is sort of less, that's a good thing. But if your MRI says it is more and your pain is slightly lesser, so most of the people, what they do is they start thinking about the MRI and their pain starts increasing. So you are not supposed to do like that. Okay, so please understand, you are not your MRI, you are just what your body is telling you, that I am this, and your body is saying that now I am having pain here, I want to treat it. So you have to go into that direction instead of what the MRI is saying. I've seen a lot of people having disc bulges in MRI, and then they had a little bit of pain, but then whatever exercises they were doing with the physiotherapy, they all went into increasing their pain. And then they started just strengthening their hips, strengthening their legs, and then their pain started coming down, because all the body is working in a harmony, right? So if you are not working in a harmony with the body, then there are chances that you will feel a lot of pain, even with less things being depicted in the MRI. Okay, so this is one thing. Then is so second is ki whenever the doctor says that bone on bone is there, so try to understand this very logically. The phrase bone on bone is rarely a precise or a we can say a scientific description, right? It's often used as a dramatic shorthand that creates sort of fear and a sense of inevitability. So real bone on bone contact is actually less common. I would say just maybe all the people who are having knee pain, maybe out of 2 or 3% of those will have a bone on bone. What do you mean by bone on bone? For example, this is your upper part of the knee, the lower part of the knee and the upper part of the knee. Now what our body is made up of is, we are having a lot of synovial fluid, okay? When we are born, when we are having walking, when all these things. So when the knee is moving, what is in between, which is not giving us any sound or anything like that, that is synovial fluid. Okay, now what happens, because this fluid is made up of all the things like your omegas and a lot of vitamins and minerals that we have in our body, the fluids, but eventually what starts to happen, especially in the city lifestyle, that we are not getting a lot of good quality vegetables, a lot of good quality fruits, everything is adulterated and all these things, and we are not able to get all the vitamins and minerals that are required to keep the synovial fluid 80 to 90% or 100% in between this area, right? So what happens, we are walking on our knees since the day we are born. I mean, starting 2-3 years we are crawling and all, but after that we are just on our legs, feet only, right? So from there only our hips start to use, our knees start to use, our ankles start to use. Now what start to happen is this synovial fluid is working every day, in and out every day it is working. So of course there will be wear and tear, right? We don't use our shoulder that much as we use our knees. That's why the shoulder pain, even if it is there, it may show up after 10 to 15 years, but the knee pain might show up in just 1 or 2 years. Okay, so this is the thing. So that's why how can you even imagine that it will go to 0%? Bone on bone is a case when this is rubbing like this, and this is very rare. You can yourself understand in this person, the pain can be, I mean, I don't even think, because all the clients that have come to me bone on bone, they have less pain now, they have, good management of the knee pain now, because if this is rubbing, I mean, I cannot do anything. If this is rubbing, if there is no fluid left, how can I help you generate? Okay, there are few diet things that are included for improving and increasing that fluid and all these things, but that takes a lot of time, and maybe in this, surgery is the only option. So bone on bone thing can be recovered easily, right? So real bone on bone, as I said, is a complete loss of joint space and is actually less common than the phrase suggests. So even when the joint space is narrowed, that doesn't mean that the joint is grinding itself every time you move. No, you are causing, and most of the people who come to me, they always say that is a bone on bone, and I think that if I am walking, I am creating further damage. And this is very common in Indian women, because what happens when they have a lot of pain and all these things, they stop moving, they stop going out, they stop socializing, because of which there is a mental toll also that's coming. And then because they think that walking and all these things are, damaging the knee more, because it is rubbing more, it will his jayega, it will start wearing and tearing more. And if it is wearing and tearing more, if with running, if it is getting lesser, then how can you increase the gap in between? You have to think about it. So for example, if this is your thigh muscle, if this is your calf muscle, so you have to work on the thigh, right? You need to maintain a gap, you need to bring them far also. How can you bring, if this is your muscle and this is not holding it tight, how can the bone remain at a particular place? So I have to start working on muscle strengthening and joint mobility, muscle flexibility, all these things we have to start working. In these things, the reality is that your osteoarthritis pain can be zero as well. If your knees are strong, joints are strong and stable, they are highly functional and capable of tolerating load when trained properly. I've seen a lot of people in just 2 to 3 months of grade 1 osteoarthritis walking and climbing stairs really pain-free. Why? Because they have started working on the mobility, flexibility and strengthening. That is very important. Now next is your arthritis. What we hear from the doctor, it is wear and tear. Doctors always say that it is a wear and tear of your joint, okay, of your bone. But what actually is, so for years, osteoarthritis or arthritis was explained as a simple wear and tear, like a tire that is gradually balding until it must be replaced. But modern science, what it says is that arthritis is a biological process, not just a mechanical erosion. It is not that much of erosion. Now, arthritis, if you segregate this, arth and ritis. So, arth means earth means your joints or bones, and ritis or itis means inflammation. So it is actually more of an inflammation. It is related to your metabolism, genetics, previous injury, activity history, sleep, body weight. All these plays a very important role in case of osteoarthritis, and not just osteoarthritis but other arthritis also, like rheumatoid arthritis and other arthritis also. But we think that it is just the knees, it is just the bone, it is just this thing, but it is not, right? So dynamic, what they say is these symptoms can improve or worsen depending on how you load and take care of your joint. So means osteoarthritis is, I believe is the most easily manageable thing that you can have. Okay, so you don't need to worry about it a lot, and it can be managed easily. So they say it was a bone on bone, but now they are walking without any pain, right? So all this can happen. Now, last one is movement is medicine for arthritis. Now what happened, I'll tell you. Whenever you will start moving in case of osteoarthritis, one thing that will start is you will start feeling that your pain is increasing. Initial few days. There are a lot of cases. For example, I'll take a sample space of 10 people. Now 10 people come to me, they start with my knee pain relief program, and now for initial 5 days they did with me, from Monday to Friday they did with me. And now what happens, out of 10 people, 5 to 7 says that my pain has reduced a bit. I am saying only, maybe if earlier their pain was 9 by 10, now it is 8 by 10, just this much, okay? Because it's just 1 week. Now, the other 5 or 4 people who are left, they'll come to me and they'll say, my pain has increased. And there are a lot of chances that your pain will increase in the initial 15 days. But now, out of these 4 or 5 people whose pain has increased, what they'll do is, I'm pretty sure about that, what they'll do is they will stop doing the sessions. Why? Because they think the exercises are increasing the pain. But what's happening? Body, if you say, what happens even if you open up your X-ray report or MRI report, they will say that there are osteophytes. Now, osteophyte is something, you take an example of a bacteria or a virus that is in your body. Now what happens when you start to fight that virus with all the natural remedies? It comes back stronger, it comes back. So here is the same thing that is happening in your body. If you are fighting that inflammation, it will get triggered, right? It will get irritated for once. But you have to stop that inflammation with the exercises only. So start slow, go more slow. If the doctor says, asked you that you are not supposed to sit on the ground, then don't sit on the ground. You just sit on the bed and do the exercises. You just sit on a table and do the exercises. There is no limitation. You are creating your own limitations. Okay, so you have to be very regular. Like I'll just give an example. There is this one woman in my community. She has taken a 3-month program. Now every time she is stuck in a loop. If you are in this loop, 3 days you do exercise, you feel slightly better, but 1 day you rest, then the pain increases. Now you think that it is because of the exercise that pain is increasing, and now you stop for next 4 days, and then you again join for 2 days, and then again this happens, and then again the pain increases, you again stop. This is a loop that you are stuck in, and you have to get out of it. This is a trap. If you will stay in this trap, you're gonna stay in this forever. Osteoarthritis grade 3, grade 4 may take 1 year also to take you out of pain, may take 2 years also, but 2 years of you dedicatedly focusing on yourself, getting out of the pain, okay, is much better than you living in 50 years of pain or 30 years of pain or 10 years of pain, right? So start working on it. And then regular physical activity is associated with less pain, better function. You have to go into a progressive thing. So I've seen a lot of physiotherapists. What they do is the same exercise they are giving in the first month, second month, third month. you will not improve. First month you will feel that okay, my pain is reducing a bit. Why? Because you have started the correct exercises in the right direction. But now the progression is not there, the load is not there. Always you are using this light resistance band. You have to upgrade also, because then only your strength will increase. If you will not upgrade, the body will adapt to that, then you are back again in pain. So that thing you are not supposed to do. Okay, so this is the thing. What happens and what this meant for me personally, and what happened in my case was, as I told you, there was a muscle tear and something like that, but I never went under an X-ray or MRI, so I just think all these things myself, and now I'm fine. So what happened is there was pain, then this pain started through the hip because it was a nerve compression, then it went down onto the knees, then it affected one knee for around 6 months, then another 6 months it starts coming in the another hip, another knee, and both the sides were affected. I was training a bit, but I was going out and walking and doing all these things more. So walking helped me with the hip pain and the back pain, but eventually the knee thing, you have to, like, I started getting sort of afraid of my own body, afraid of pain, afraid of the future, because I was personally in the field of yoga already for the past 10 to 12 years, and I always wanted to be in this field for as long as my life allows, because that's something I love and that's sort of my passion. So I always wanted to be in this, but ironically I was going in the protection mindset that okay, I will not climb stairs, I'll take lift. But then what started to happen, because of that the muscles started weakening, the joints became less tolerant, pain was more persistent in that case. So all these things might happen to you as well, but you have to continue, because I was into the fitness field, so I was very dedicated that no, I don't want any pain in my body. I have to get out of it. So I began with a structured progressive strength program, which I designed back in my research of my master's for approximately 10 ladies in an experimental research. And then I started with the leg strengthening program, which also includes the knee strengthening program or the knee pain relief program, because your knee is not an independent joint. It is dependent on other muscles as well. From your hips, from your thighs, from your hamstring, glutes, all the things are connected. Your body works in a harmony, and it is very important that you have to start working on each part, each muscle, and not just the knee. Because initially what happens, if you start moving the knee more, the pain might increase even more, and I don't want that. So you start with the hips, thighs and hamstring. You start with muscles, because muscles are much better stabilizers. They can keep themselves more stable than the joints. So it is better to start working on the muscles first, and then you eventually work on the joint mobility. So muscle mobility, muscle flexibility and muscle strengthening in the initial 1 to 3 months is very important. Then you shift to that. Okay, so video has been pretty long, but I believe this has been helpful, and it helped you take out all the crap that you have in your mind regarding your bone on bone or osteoarthritis. So I'll see you in the next part, wherein we'll talk about more of knee pain, maybe inner knee pain, outer knee pain. You can put it in the comment section where or which pain you want to talk about, and we're going to talk about that. Thank you for joining in, and I'll see you next time. Don't forget to subscribe my channel and comment if any doubts. Thank you.